Hi everybody, and welcome to today's meeting for an exclusive preview of the Global Summit for Eye Health Policy Framework that is due to be launched very soon. For those of you who don't know me, my name is Rachel Buck and I am IPB's Membership Manager. So here is the agenda for today's meeting. Firstly, IPB's CEO Peter Holland will provide an update on the Global Summit since our last all-member meeting in February. He'll then hand over to Dom Haslam, who's the Deputy CEO and Director of Policy and Programme Strategy at Sightsavers, who will go on to talk about the summit's objectives and the policy asks that the summit is calling for. Fiona Lawless, who's Policy Advisor for Health and Inclusive Data at Sightsavers, will then present on the policy framework. And lastly, Drew Keys, IPB's Director of Advocacy and Policy and Strategy, will go on to talk about the different ways that you as members can get involved. And finally, if you have any questions at all, please feel free to put them in the chat box throughout the meeting. We'll also be taking questions at the end, so you can use the raised hand function as well. So I'm now going to hand over to Peter.
Rachel, thank you very much. And I'll add my welcome to everybody. Thank you so much for joining us today, whatever time it is with you. So as Rachel said, the purpose of this session is to really look at the policy framework that we've been developing for the Global Summit. So I'm not going to spend a lot of time talking about the progress we've made. We spent a lot of time a couple of weeks ago at 2030 Insight Live discussing that. So I'm sure many of you will have heard that. But just quickly, take a step back and remind you about why we think we wanted to have a global summit. We've obviously made a lot of progress at global level in terms of getting eye health onto the global agenda. So now the challenge really is about getting governments to implement what they've committed to. And that's really the key purpose of the summit. It's to galvanise action at country level, in Aubrey Webson's words, to turn words into action. And that's really the point of the policy framework that we've been developing. Right from the outset, we've said that we don't want to develop a new set of global policies and commitments. We've already got those set out in a number of resolutions, including the UN resolution, a number of World Health Assembly resolutions. But we do need a framework to really package up those policies and set out the priorities that guide the discussions that we want to have with governments about what the commitments, what the pledges that they would bring to the summit. And we also then need a mechanism to measure that progress. So we have established a policy and legacy committee to lead this work. It's drawn from members across the membership, and its focus has been on both developing this policy framework, and then it will move on to looking at the mechanism we have for monitoring. It's being chaired by Dom Haslam, who I'm sure many of you know well, the Deputy Chief Executive of Sightsavers. And I'm now going to hand over to him. But before I do that, I just want to add my reminder to what Rachel said. If you have any questions as we go along, please do put them in the chat and we'll capture them and try to respond to them at the end. But it'll also be useful for us to develop an FAQs as well. So please do use the chat to raise any questions. So with that, I'll hand over to Dom.
Peter, and great to see so many of you on the call as well. Good to see the level of interest. So what I was going to try and do is two things essentially before I pass on to Fiona. So one is to kind of look at why we're looking at a kind of policy framing, what the summit is aiming to achieve that's different to what we've all been doing together for so many years, and really that's about what we're calling reframing the proposition, reframing eye health as an investment and as a development issue that needs to be taken seriously and prioritised primarily by governments but by other stakeholders as well. And then looking at the specific things that we're asking for. So we're kind of producing as the committee, which has I think 9 full-time members drawn, as Peter says, from across the membership. As the committee, what we're trying to do, working with other stakeholders, is to put our proposition in a slightly different way, and to create a document which is useful for engagement with stakeholders who perhaps aren't our normal bread and butter advocacy and policy influencing targets. So heads of state, for example, but also others, CEOs of companies working in the sector and beyond, and other development stakeholders. And so we're creating this first document, which is a kind of summary document of the policy aims that we have, and as I say, setting out why eye health is an important issue, but then also going into a more detailed framework, which is perhaps takes us back into more traditional lobbying territory of going into the details of policies that we want to see changing, but expanding that out from our normal frame of reference. So normally we talk about health a lot, and we talk to health ministers a lot as a sector. What we're looking to do is broaden both the stakeholders that we talk to about eye health, but also the way that we talk about eye health, the things that investment in eye health can bring you, why they're important for example, a finance ministry as much as they are for a health ministry, and for an education ministry as much as they are for a health minister as well. So that's the kind of aim of the work of the Policy and Legacy Committee. There's a secondary part to what we've been set up to look at, which is the accountability. So let's assume that we have some success as a sector in getting other stakeholders engaged and involved and interested in eye health, that we're holding a series of events leading up to probably a single eye health summit at some point in the next 18 months. How are we going to know whether people are doing what we've got them to agree to do, or the promises or commitments that they've made? And that accountability framework and how we measure progress and how we ensure that people are living up to those promises is a kind of second area of work for the committee, and we'll be looking at that in the next few months. So, firstly, what's the summit aiming to achieve? So, firstly, it's around reframing eye health as a growing global challenge, and importantly, one that can be addressed. We're all aware of all the growing global challenges that there are out there, but this is one that can be addressed relatively simply, where we have a really good evidence base for those low cost and proven interventions which can prevent or treat 90% of vision impairment cases. So we know we have a compelling proposition in terms of, yes, a growing challenge, 2 billion people living with poor vision, and it being a rapidly growing public health challenge. I'm sure everyone on the call knows about the demography and what we're looking at in the eye health sector over the next 10, 20 years. But that it can be prevented, it can be treated in a relatively low cost way, is different to some of the other global challenges that are being faced by world leaders. So that gives us a potential advantage in requiring and requesting this to be a priority. Secondly, looking at eye health as an economic opportunity at national and global levels. So it's not just a health opportunity. There are benefits beyond the individual impact that an eye health intervention can have, or even the community impact that an eye health intervention can have, because unaddressed vision impairment is estimated to result in annual global productivity losses of $411 billion, and 6.3 million years of schooling are lost each year, with a potential future economic productivity loss which is projected at $173 billion US. So this isn't just about investing for that individual health impact. That's a good thing to do in and of itself, and that's what the focus of our asks around eye health have been traditionally. But this is something which is good from a finance ministry point of view, from a head of state point of view. It's good for the nation's economic health, and that's the argument that we want to push. It's also a whole of life issue. And when we think about how we as a sector have talked about eye health, certainly for me coming into the sector 20 years ago, I very much saw eye health as an older person's issue. I saw it being around cataract and unoperated cataract. And that wasn't because I didn't know anything about development. I've been working in development, including the health sector, for 10 or 15 years, but very much the eye health sector's projection of the issue was around cataract. And of course, cataract and the impact that cataract has at later stages of life, well, middle age and later stages of life, is significant and will continue to be significant, but it's not the only issue. And for us to reduce it down to being an issue outside of those productive adult years, but also infancy and preschool years, is reducing both the messages that we put out there, it's reducing the impact that those messages can have. So we're reframing it as a whole of life issue. Yes, there are specific areas and specific impacts at infancy, preschool level, at adolescent level, economically productive adulthood level, and in older age, as well as whole of life issues. There are also areas that have an impact across the life cycle, both directly and indirectly on individuals affected, but also communities. It's a great, yes, it's a great statement in the chat box, and I must apologise because we should have updated the presentation and we haven't. We've actually amended the policy framework document to talk about older age, not old age, 65 plus years, or older people, and that's the framing that gets used by the age-focused development community. So yes, very good point. Thank you, Scott, and well noted, and we have taken it. We have had that feedback already and taken it into account, just not in this presentation. So my apologies for that. So as a result of it being a whole of life issue, it requires a proactive, coordinated and integrated whole of government response. And we're providing that detailed sample policy framework, which Fiona will introduce shortly, for different life stages and areas of government and policy. So the really critical thing here, the things to take away in terms of what's different from how we've talked about it before. Yes, we've talked about it as a global challenge before. Yes, we've talked about it being addressed before, but we haven't talked so much about the economic opportunity. We've talked about it as a health issue far more, and also a reframing to being a whole of life issue, and one that, as a result, should have an impact and an interest across government and different policy areas. Thank you. Next slide, please, Rachel. So what are we actually calling for? We've had lots of input and discussion both within the group and with other stakeholders. We've had sessions like this where we've asked for input and feedback from members. We've also talked with external stakeholders like the World Health Organization and really kind of sense check these areas of change that we're looking for. So these 7 areas are the ones that will be in that overall summary document, the ones that hopefully will appeal to those who have responsibility across government and at the strategy level rather than just health ministries, but obviously of import to health ministries and health ministers as well. And as I say, those boil down into 7 areas, each which has a significant amount of detail that sits behind it in the policy framework that Fiona will introduce shortly. So one is around integrating eye health into broader health systems, including school health, and specific areas of the health system that we feel need particular attention: screenings, services, rehabilitation, equipment, technology. Second area is around financing, so prioritising sustainable financing for eye health, which includes a mix of domestic resources, something that we haven't perhaps pushed so much as a sector before. We've been perhaps more focused on things like public-private partnerships, private company investment, and support from the multilateral system and the official donor system. I think now we're absolutely recognising, particularly given the circumstances and the change in the aid environment this year, domestic resourcing has to be a fundamental part of it, and that's something that we expect governments to sign up to as the duty bearers for the health system in their countries. Thirdly, monitoring. So I talked a little bit about the accountability framework beforehand. Yes, there does need to be some investment in tracking of progress against these commitments, but most importantly, tracking of progress within data systems, statistical systems within governments on their national and global eye health targets through those strengthened national monitoring mechanisms. Fourthly, regulation, so creating an optimum regulatory environment, and there are a number of ways that we feel things need to shift in order to do that. So through tax changes, through regulatory reform, through standards and practices, for example, removing regulatory barriers for access to spectacles. And the idea for this is to unlock the innovation and the potential for scale in the public sector, but also in the private sector. So making sure that that regulatory environment is conducive for that investment and progress. The fifth area is workforce, so increasing access to quality eye health services through recruitment, training, distribution, and retention of eye health workers, but as well as that, investing in technological advances to expand access. And it's really important, we feel, to get the balance between those two things right. So yes, investment in technology. There are significant opportunities which many IAPB members are already involved with around digital health. And we're all talking and thinking about artificial intelligence and what impact and support that can provide. But it needs to be within a framework of an expanded, active, well-distributed workforce as well. It's not enough to invest in those technological advances. And I think that's something we've got to think about really carefully when we're talking to government, because people are looking for exciting, quick fixes potentially. And we want to be clear that yes, there may be some exciting advances and exciting investments that can be made, but they've got to be backed up by a traditional health workforce. And the balance of those two things remains important. Number 6 is around partnerships. So I've talked a bit already about the private sector, but bringing together private sector, civil society, academia with government to promote eye health and deliver services. So of course, there is a role for NGOs, there is a role for academic research, there is a role for the private sector, but that all needs to be done under the leadership of government, within the government framework, and with the government's overall ownership as the duty bearers. And finally, inclusion. So 2 aspects to this. Firstly, ensuring that when it comes to the provision of eye health services and all of the related aspects across government, we need to ensure that there's equity between population groups. It's no good going for a quick fix and easy response that increases access to eye health, but only for a limited group of the population, potentially in urban centres, for example, or particular population groups such as men or the more educated. We need to be looking at access to services being equitable across countries and within countries. And the second aspect to inclusion is ensuring that people with visual impairment that cannot be treated or reversed are involved in policy making, and that's in particular with reference to health policy making. Okay, so those are the kind of broad areas. I'm now going to pass over to Fiona, who's going to talk through some examples of the policy framework. So we're not going to share the whole policy framework with you. It's quite detailed and it's still undergoing revision as we speak. But we're going to share some examples of the way that we're trying to put this framework together and the kinds of things that we're looking at across various different aspects of development policies and processes. So Fiona, over to you. Thank you.
Thanks, Dom. I guess to indicate how this is going to work, there is that kind of a narrative document that Dom just spoke about, which is kind of targeted at heads of state. It provides a reference point for people who may not be as embedded kind of in the weeds of the discussion as others. And then this table is targeted towards the policymakers, towards the specific ministers, and it gives examples of commitments that could be made at the global summit, or the commitments that governments could make based on different ministries, line ministries, and that's how we have set this out. Now, in terms of what I'm going to present here today, as Dom said, it's still under construction, but we're getting there. And I want to talk a little bit about sectors beyond the health sector. So in general, we talk to the health sector quite a lot. So what I'm going to present is around some sectors that are not the health sector in terms of commitments that governments could make, whether it is social welfare, whether it is transport, whether it is treasury. And as you'll see from the screen, this is some examples of commitments that could be made in terms of social welfare ministry, and it is broken down across the different stages of the life course, as we spoke about in the narrative document. So it includes things like increasing social supports for people living with permanent vision loss, looking at financial support mechanisms for people who cannot afford eye care services and treatment and rehabilitation, looking at incorporating assistive technology into publicly provided health insurance schemes, or incorporating rehabilitation services into wider community welfare schemes and outreach services. Then we also look at things around ensuring clear pathways and support for community workers to help with identifying those who have some eye care problems, and resources and training for those community workers. And these are workers who are not community health workers. A couple of other options include looking at programs to provide glasses to school children free of charge, implementing support services, and then again, public health insurance schemes that include eye care provision like cataracts, management of diabetic retinopathy, etc. Next slide, Rachel, please. Thank you. And then there's also stuff around the Ministry of Labour, Ministry of Employment, some things around Ministry of Transport. We've framed it as sectors rather than specific naming of ministries, because obviously the titles of ministries vary country to country and can change depending on the government. But we have some examples of things like developing and incorporating workplace eye safety standards or workplace screenings for vision impairments, and particularly for near vision impairments within the working age population. Things around computer vision and computer vision correction, guidance on managing screen time and lighting in offices, occupational health and safety policies that incorporate eye health and vision considerations, and then zero discrimination policies for those who have vision impairment. And then around transport, things like ensuring that eye screenings and vision tests are a requirement for driving license regulations, and then mandatory testing for professional drivers, and subsidies for corrective prescription glasses if people drive for work. Now, as I said at the start, this table is designed to be a reference document for people to choose what commitments they would like to make, what ministries would like to make. And it's not designed for someone to select all of these and make a commitment on every single thing. If they did, that would be great. But it's designed in such a way that it gives examples and suggestions of commitments that governments could make, that the various ministries across different within the government can make. And like I said, it is broken down in terms of whole of life approach and across the various age brackets. And also just to say that, like we said at the start, this is still being finalized. There's still some feedback coming in terms of this, but it will be officially launched next week at the World Health Assembly, and it will be uploaded online at that point. So just passing back to you then, Rachel.
Thanks, Fiona. Now I'm going to hand over to Drew, who's going to talk about the different ways that members can get involved.
Thank you, Rachel, and thank you all for being here this afternoon or this morning, wherever you may be. It's great to see so many of you. I'm also very aware that many of you were together with us in Nepal a couple of weeks ago, or online for the earlier membership discussions a couple of months ago. And so this is really just a refresh on the political and institutional engagement groups that have been set up by IAPB and our members to disseminate information for the Global Summit for Eye Health, and also to ensure that we are spreading the word about the policy framework. So for those of you who just want a quick little recap, we have regional and national groups, and the members of those groups are participating in monthly virtual meetings, which is really important, so that the conversation is always fresh. People are getting regular feedback, and information is being fed back up the chain to the policy and legacy group. That we are identifying and engaging relevant people at a national level. So thinking back to those examples 5, 6, and 7 that Dom presented on workforce, on partnerships, and so on, it's really important that we are starting to identify the right people, and thinking about the various ministries and the conversations that need to be had within those ministries that Fiona started to highlight. We also, of course, are still continuing to identify and engage champion countries in each region, as well as interested countries per region. We need to be considering their needs and priorities to reinforce those national level asks and ensure that we are getting the commitments that we are looking for. Just a reminder to everybody that these groups regularly report back to the global governance group, which in turn is responsible to the IAPB Board of Trustees through its co-chairs. So all of that information on the dissemination will then get fed back up the chain. So if you would like to get involved, or if you have identified that there is no relevant body yet in the country in which you're working, please do get in contact with Rachel Burke. Rachel's email address is there on the screen, and Rachel will be able to point you in the right direction or connect you to the right people. Thanks, and back to you, Rachel.
Thanks, Drew. Oh, and so now we are finished presentation, and we're just gonna, if there's any questions at all, please do write them in the chat box or use the raised hand function. I see we've got a question in there already. Fiona or Dom, this is for you. How does low vision rehabilitation and blind rehabilitation factor into the framework?
Very much, Rachel. Fiona's already had a go answering it in terms of the kind of more detailed framework. I'll maybe just add a couple of points there in response to Daniel's question. So the answer is in 3 different places, Daniel, within the document. So firstly, when we set out the reframing that I talked about at the beginning, reframing as a growing global challenge, as an economic opportunity, and as a whole of life issue, we talk in the whole of life issue section about proven cost-effective policy solutions being available to support prevention, treatment, and rehabilitation of eye conditions and visual impairment across all stages of life. So rehabilitation is there in terms of that whole of life issue. Then when we go into talking about whole of life within the age framing table in a little bit more detail, we talk about addressing avoidable vision loss as being a global priority, but also the full and equal inclusion of people with unavoidable visual impairment is equally important to ensure no one is left behind. So that's a reference back to the Sustainable Development Goal framing. We talk about rehabilitation in the integration of services part of the policy requirements. And then finally, we end the document with a clear statement that those with unavoidable blindness need to be empowered to participate in and contribute to society. So there's a few different ways in which we talk about rehabilitation, but yeah, good question. And we definitely wanted to make sure that it did include those aspects of inclusion, which rehabilitation is part of, as well as the health service provision. Thanks.
Thanks, Dom. And Maria, I see you've got your hands up.
Yes, thank you. Just a clarification, in the framework, you mentioned 3 areas which are very important, obviously, the regulation, workforce, and I was wondering on partnerships, and perhaps it's obvious, but I didn't see the professional associations of ECPs specifically reflected, and obviously they do have a role to play in providing or creating an enabling environment, and also they will definitely have a key role to play in terms of the workforce when you start referring patients. So is there a reason? Is it obvious? Because I'm just joining this conversation, so perhaps it's obvious, but for me, it seemed like it was not explicit enough. Thank you.
Thank you very much, Maria. I'm afraid I had to take my headphones off because they stopped working, so I missed part of that question. Fiona, I don't know if you want to have a first go and then I can add, but I think just as a very top line response, I think that's right. I think we've got to get the balance right from the perspective of the committee between focused requests, so things that we specifically want to call for as an eye health sector. So definitely focusing on the eye health aspects of the health workforce overall and the broader workforce overall, but definitely not ruling out that there are other investments that are needed in other sectors, both in health and more broadly than that as well. So absolutely take the point. But Fiona, I don't know if you want to add to that in terms of any of the discussions we've had in the more detailed policy framing document.
I guess the only thing to add really is that we were really conscious of trying to keep this document succinct and kind of quite high level, and trying to avoid, I guess, repetition across the narrative document as well. And that I think we did not want to repeat around workforce as well as within partnership, because that felt like it was a given to a certain extent. We do partner with eye care professionals and we do partner with the health sector more broadly. And I think we're trying to move the conversation beyond that.
Thank you. Got another question in the chat box. Is the National Nursing Lobby included in the national planning discussions? They're a powerful group and key to anything happening. Drew, I think that's for you.
Thanks, Raheem. It's a really good point. It's actually up to the national groups to engage with the various stakeholders in country. But certainly we would be recommending that absolutely the nursing lobby, the nursing sectors, in fact, any of the various strands of professional bodies be included in any of the national planning discussions. So yes, so if you're involved in building up those discussions in country, absolutely engage with them.
Thanks, Drew. We can see also there's a comment from Kira at Prevent Blindness. Because of the target group of stakeholders and national leaders in many sectors of government, health secretaries, companies, etc., may want to consider integrating language about the role that eye examinations can play in early identification of other conditions, diabetes, kidney disease, Alzheimer's, etc., to promote long-term health more holistically. In other words, addressing vision health can facilitate a national approach to broad health maintenance. Thank you for that, Kira. We'll take note of that. Also, Jeffrey, it looks like you've got your hand raised as well.
Rachel, can I just jump in on
Yeah, of
the point
course.
from Kira, because it's an excellent point, and I just want to rest assured that we have addressed that, and we're very aware of that, and that's the whole point of this document, is trying to make sure that we're really clear about all of the different ways in which an investment in eye health can be beneficial across a whole range of different policy areas. So obviously the link to education, which people have been talking about for some time, also around things like road traffic accidents and so on. But in the adulthood section, Kira, we specifically talk about the positive impact that can be had around other NCDs, whether that's around prevention, whether it's about the connection between different conditions. But we specifically talk about diabetes, hypertension, coronary artery disease, and so on, and the connection between those. So yeah, very much take your point on board, and I think it's one of the ways in which we can strengthen our ask as a sector that perhaps hasn't been as strong as it could be in the past. So very much hope, yes, we're heading in the right direction on that front. Thanks for your point.
Thank you, Jeffrey.
Yeah, thank you very much. I had a suggestion on the page which talks about reframing eye health as a whole of life issue. Suggesting that we make it stronger, instead of saying almost everyone will be affected by an eye health or vision problem, to put all, everyone, actually, not almost everyone, but everyone will be affected. And I mean, it may create some bit of questions and doubts in some people, but when they think about it, it's actually true that everyone will be affected by an eye health or vision problem in their life at some point. Thank you. Thank you.
I could respond to that if you want to, Rachel. And also Daniel's point. Yeah, I mean, couldn't agree more. And I think the document is very clear on that and does talk about that very clearly. Almost everyone will be affected by an eye health or vision problem in their life. We could say everyone, depending on whether it's direct or indirect, but certainly that we do make that case really clearly that it's not something which is about a proportion of the population, a group of the population. It's very much whole of life, and it's very much whole of population. Specifically, what the risks are and what the particular epidemiology might be for different groups obviously differs. And that's not something we're going into in this document, because it is meant to be a summary document. But definitely that point, I think, comes across quite strongly from this. This is not a niche issue, it's a population-wide issue, and as a result needs addressing as a priority, but there are also significant benefits to doing so outside of that individual health impact. Just while I'm here, I've also got Daniel's question in the chat box about whether the framework envisions cooperation with ministries of labour to help prevent industrial eye injuries with appropriate PPE for low or no cost to the labourers. I'll maybe let Fiona address whether we've specifically talked about PPE as a kind of policy response. It doesn't specifically talk about cooperation with ministries of labour, Daniel, but it does kind of have that as have that kind of whole of government approach as part of the whole kind of framing that we're putting in, that this isn't just a health issue. So yes, in principle it does, and what the document does do is specifically state that poor vision can increase workplace injuries, reduce productivity, and lead to economic losses. So the policy framing and response is obviously requires things like working on labour laws and labour processes and systems. I'm going to say I doubt that we've got a specific policy framing in there on PPE for low or no cost to the labourers. I suspect that would come down to that individual target setting or commitment setting that governments want to do. So that might be a specific area they want to address in order to be able to demonstrate progress in a particular area around economic policy, for example, rather than us saying this is one of the many things that you could address, because if we go into that level of detail in the policy framework, it's going to be too long to be usable. But yeah, really good point. I don't know if you want to add anything, Fiona. Thanks.
I think you've covered a lot of it. Like you said, if we went really, really granular with this table, it would be a dictionary length. But I think that aspect that you're highlighting, Daniel, would fall really well underneath one of the Ministry of Labour employment asks is around developing, incorporating, and monitoring workplace eye safety standards for all employers, especially for industrial, agricultural, and other high-risk industries. So we're talking more around a government putting in place these policies and procedures and potentially looking at something like appropriate PPE at low or no cost, but that would be the government within their policy in that regard.
Thank you both. We've had another question in the chat from John Barrows. Dom, I think this is for you. The private eye care sector often drives innovation and service delivery improvements that influence government policy. How are private hospitals and residency programs being integrated into national eye health strategies and training frameworks?
Probably not as much as they should be, would be the answer, John. I mean, I think in terms of the role that the summit plays, I think that this document, this policy framework, is really clear that the private sector has a clear role to play, and that should be welcomed and embraced. But kind of as you're suggesting in your comment, within the overall ownership, the overall framing, the overall regulatory oversight of the government system. So that innovation can definitely come from the private sector, but we've also got to be clear that what's done there is within that overall framing, which is related to patient safety, but also just related to the kind of integrity of the health system as a whole. So I think what we've got in the document, and we very deliberately had a couple of IAPB members representing the private sector in the committee. I think what we've done is kind of take the benefits of what the private sector can bring and brought that into that overall kind of governmental ownership. I think what's going to be interesting for me, and it's something that we'll be discussing when it comes to accountability and the kind of commitments that sit behind this framework that we're asking for, is are we also asking the private sector, academia, NGOs, and so on? Are we also asking them to make commitments? And if so, what would those commitments look like? So, for example, how private hospitals, residency programs, and so on, how innovation that comes from the private sector is going to be utilized for the maximum public health benefit, and so on. So I think there's a question in kind of both directions on that, but I hope the document does what you're asking for, which is to encourage that partnership approach between the two. Don't know if anybody wants to add to that.
Dom, I might just add, I think it's a really good example of the sorts of stakeholders that we should be engaging at a national level when we're having conversations about the policy framework, as an excellent way to continue to embed it across the sector and with the various ministries.
And I guess just to add that if a commitment is made around partnership and opening up partnership to the private sector for driving innovation, it's a really useful then advocacy tool for what comes after the summit, which is if a government is refreshing a national eye care strategy or training frameworks for people at national level to ensure that those key stakeholders are also involved in that process.
Thanks all. I see, Serge, you've got your hand raised.
Yeah, thank you, and thank you for sharing this. I think this is really very exciting. My kind of question and comment is about the return on investment and the case for investment. This is clearly very important, and I think kind of developing that and making something that is much more appealing than what we used to do before is great. Having said that, it happens to me to speak to some of these ministers in my separate kind of life, professional life. People are not much interested in long-term investment, honestly, because they have a short-term job. And they are mostly, I think, interested in what allows to save money right now. So I think if we could add somewhere that angle about what can be really saved right now, in addition to the long-term investment, that might be also helpful.
Yeah, I can maybe do a quick comment on that, and then I might pass. I don't know if it's to Drew or to Peter to talk about the work of the Case for Investment group, because I'm not actually sitting in on that one. But firstly, nice to see you, Serge. It's been far too long. And yeah, I think it's an absolutely valid point, and certainly, we know when we're talking about returns on health investment, if we're talking about democratically elected governments, which fortunately a large number of the governments we're talking to are, their electoral cycles are not going to see the benefits of any investment that they make. And I think it's absolutely right to recognise that. So yes, I would hope that the case for investment would include something along those lines. Of course, the really critical thing for us is that we know the direct impact on out-of-pocket expenditure of individuals is significant, and that freeing up that cash to be spent on other things, more productive things, is also good for the economy in the short term. So hopefully that kind of argument will make its place. But yeah, I absolutely agree with you. We can't just rely on 10-year, 15-year return on investment cycles. But yeah, I don't know, Drew, Peter, do you want to add to that?
Thanks. Sorry.
We can see and hear you.
I shouldn't have, you can already hear me. I shouldn't have unmuted. That was my problem. Yeah, I mean, just picking up on that. Thanks, Serge. I'm pretty sure that the case for investment is looking at timeframes as well as the overall benefits, and I will certainly take that back. I mean, it strikes me that actually eyecare is quite well placed for this. So there's quite a lot of impact, which is quite short term. And we've seen that in terms of, some of the studies that are informing that, whether that's the impacts of glasses or indeed of cataract operations on earnings and on productivity, which are, you see within months rather than decades. And I'm pretty confident that the case for investment is going to be showing that over those timeframes. The other thing it's going to try to do is to come up with a view of the cost and the cost benefit of the actual interventions themselves. That's quite challenging to get the a sufficient evidence base across globally. So getting perspectives from different regions, indeed different countries, is quite a challenge. But they are going to try to do that as well, and at least be able to give some sense of what the actual, what on the cost side, what the investment looks like as well.
Thank you. Is there any more questions at all before we wrap up? Okay, what we'll do after this meeting is we'll send the recording out to everybody, as well as the presentation slides. I'm just going to share in the chat box now. We've created a page around what we've spoken about today on our website. This is being developed, but we'd obviously like you to view it and see what we talked about. And if you do want to get involved at all, please do contact me afterwards. As I said, I'll circulate the slides and everything else, so you'll have my contact details there if you don't already. And just really a big thank you to everybody for coming today. We really appreciate your time, and I hope that you found it worthwhile. Thank you.